Okay, guys. Good evening. How are you doing? Well, as you might have seen already in your infographics, today, we were supposed to see some other topics, and today we are going to talk about two specialties. Each one is going to have a determined issue following an alphabetical order. We are going to talk about bones, right? The last class we talked about blood, and today we have to talk about bones and childhood. Okay, so as for the first one, you already know the specialty would be orthopedics, right? And the second one would be pediatrics. So I chose some basic uh, topics to discuss today. So let's get started, guys. And by the way, I took a picture of those people who were on time, okay, for attendance. So let's get started. Let me know if you can see my screen. Then we get started. Okay, you can see my screen, right?
Yes, we can.
Okay, thank you. So, as I was telling you, part of today's class will be about bones. So I chose this basic topic to talk about, right? Which would be fractures, the basics. Okay, so we're going to start now. So, what are we going? Well, first of all, from this day on, we are going to have some extra slides in our presentations due to, in other classes, I jumped in and to discuss all the topics. However, from this day on, I'm going to mm, talk about some terms and concepts before we get started so we do not have any problems when we are already discussing the topic of the day, okay? So here I have some terms that some medical equipment that is related to fractures. So here we have, this might be a little new vocabulary. So focus on the way those words are written and the way they are pronounced, right? Notice pronunciation. So the first one on your left would be crutches, crutch. Okay, crutches. You know what this is, right? Can anybody tell me a definition of this? Okay, so
Muletas.
yes, could you let me know explain a little in English?
Okay. Well, these are well, a pair of crutches is a way that we can help a patient to uh, to move to another places in their daily life.
Okay, they work as support, right? Where do they go usually? They go under the armpit, right? That's what those wooden pieces are for, right? And for the hands to grab that item. Thank you. So the next one would be a cast. Actually, a cast, this word has a lot of meanings. However, the one that we are going to discuss or is related to fractures would be something that is molded by something else. Okay, So in this case, the mold would be the forearm and part of the hand, right? So that is a cast, okay? The next one would be stretcher. And well, you can see the image right there. And it's like a framework, and it has like some sort of soft material in the middle so the person can lay on, right? So let's get to the topic we're going to discuss today. So as you all know, the bones of the body have a variety of sizes and shapes, right? So there are four principal types of bones, which are the long bones, the short bones, flat bones, and irregular bones. So these bones that are longer than they are wide are called long bones, right? So this would be a representation, and is representation of what a long bone is. And they consist of a long shaft with two bulky ends or extremities, and they are primarily compact bone, but may have a large amount of spongy bone at the ends of the extremities. So we are going to talk about compact bone and spongy bone later on and how they are also known. So long bones include bones of the thigh, the leg, arm, and forearm, right? So can anybody tell me what the thigh is? We already talked about it in the first class. THIGH. Anybody, guys? What does THIGH mean?
Muslo.
Okay, great. So could you tell me in English, please, what part between what other parts is this part of the body between? You can mention the two joints.
Is the part of the human between the hip and the knee.
Okay, great. Those are the joints, right? That this part of the body is between. So great. So the next one would be the short bones. The short bones are roughly cube-shaped with vertical and horizontal dimensions that are approximately equal. So this would be an easy way of representing short bones, right? They have vertical and horizontal dimensions that are almost equal, right? So they consist of spongy bone, which is covered by a thin layer of compact bone. And short bones include the bones of the wrist and ankles. Can anybody tell me what bones we are talking about when we say wrist and ankle? That are short bones, of course. Okay, they are the carpal and the tarsal bones, right? In Spanish would be huesos del carpo y del tarso, right? So the next one would be the flat bones. They're thin and flattened and usually curved. And well, they are mostly the bones of the cranium that are flat bones, right? Can anybody give me two examples of flat bones?
The ribs and the sternum,
Actually, the ribs would be long bones, right?
the parietal.
Parietal,
Sorry?
Hi,
parietal.
do you hear me? Hola.
Yeah, I'm listening.
The frontal and the nasal.
The frontal, okay. And which one?
Nasal.
Okay. Okay, yes. Some other examples would be the parietal, occipital, right? So those are flat bones. And here I just put a sheet of paper to represent something that is flat and thin, right? You remember what thin means, right? Thin, the opposite of white, right? And the final one would be irregular bones. Bones that are not, these are bones that are not in any of the other three categories, okay, and are classified as irregular bones. They are primarily sponge bones, and they are covered with a thin layer of compact bone. Uh, some examples of this kind of irregular bones are the vertebra and some of the bones of the skull, for example, temporal bone, right? And all bones that, well, they have surface markings and characteristics that make a specific bone unique. And there are holes, as you know, depressions, lines, projections, and other markings, and they usually represent the passageways for vessels and nerves and points of articulation with some other bones or points of attachment for tendons and ligaments. So here we have some examples. Here I found some other type of classification that takes into account the, the main four uh, types of bone. However, here we have two extra types of bones, which are the sutural bones. Um, can anybody tell me the name in Spanish of a sutural bone like this? Here in Bolivia and in Peru, we have a lot of them. I remember when I was still a student, I saw this kind of bones, actually, that the whole occipital bone had a lot of these sutural bones. Can anybody tell me the name in Spanish of a sutural bone? Do you remember the term huesos wormianos or sesamoideos, right? In anatomy class, right? So this would be a sutural bone. And here we have a flat bone, which is represented by the frontal bone, as your classmate said. Here we have the sutural bone and short bone, with, which we already talked about, such as carpal bones. They are a lot, right? And they have kind of confusing names between each other. And also represented by tarsal bones. And here we have also regular bones, which is represented by a vertebra, and a sesamoid bone, which would be the patella, a long bone, represented here by the femur. So here we have some other examples. On your left, we have femur, some carpal bones. On your right, you have a lumbar vertebra, right? Can anybody tell me that cranium bone that we already talked about? And this word, we use this word a lot when we talked about stomach and some layers of, for example, the heart. And here we have a bone called that way also. And we were struggling a little bit with the pronunciation of its name. Can anybody tell me now? This one, guys. Can anybody tell me? We were struggling with the name of this bone. Also, there were well, it had the name of a cell and layers, right? Come on, guys. We talked about it a lot. parietal, right? Parietal bone. Okay. So here we have the structure of bone, and here we have the difference between the spongy and compact bones, and this is from another point of view. The last one that we were talking about was like an anatomical classification of bones, right? According to their shapes and according to the well, if they had a bigger vertical or horizontal lengths, right? And here we have another from a different point of view. Here we have the spongy bone and the compact bone. The spongy bone is, as you can read, called also cancellous or trabecular bone, and it is found in the long bones and it is surrounded by compact bone. On the other hand, we have the compact bone, which is also called cortical bone. Okay, that is that surrounds the spongy bone, and they are heavy, tough, and compact in nature. Does anybody know what tough is? Tough, tough. Come on, guys, participate.
Duro.
Yes, great. Thank you. So it is what your classmate said. And well, depending on the context, it would also describe a person, right? Which is rudo, right? So it would be tough also. This person is tough. The compact bone is also tough, okay? So let's get into the fracture thing. Okay, so what is a fracture? Is just the loss of continuity of a bone, right? As you might have already read, if anybody already had the subjects of orthopedics, there are a lot, and I mean a lot of classifications of fractures, right? So here we have just a few, and some other slides, we have some more. Here we have fractures that are classified according to the previous state. So let's get started with fractures. A fracture is defined as the loss of continuity of a bone, and most times it is caused by trauma, usually a high energy trauma, right? Which on previously healthy bone, and that is what we most commonly see, right? A person who whose bones are just healthy and has this high energy impact or trauma, and this healthy bone, even though it is healthy, it breaks. So that is what it is. So however, we also have some um, fractures that occur on previously ill bones. What do I mean by that? By this, well, can anybody tell me what a pathological fracture is in English? Because I know that a lot of you have already read about this in orthopedic subject. Can anybody tell me what pathological fracture is?
Is when the fracture is caused by previously disease.
Okay, could you give me an example of any disease that might be related to it?
Maybe be cancer.
Great. Awesome. Yeah, so it's like the bone is already, it's like already weak, right? By some other disease. This person has this impact that it is actually not necessarily high energy impact, but it is enough to break the bone, right? So Yes, thank you. That is a pathological fracture. Fracture that occurs on a previously ill bone that has been affected by some other disease and made it weaker than usual. Thank you. So there are also some fractures that are related to some forces, some physical forces. So that is what we are talking about, fractures according to a physical mechanism. This angle forces produce transverse or oblique fractures, okay? And the forces of torsion cause spiral fractures, and the traction forces mm, could also cause avulsion fractures. Okay, and some examples would be the medial epicondyle, right, of the elbow, located exactly in the humerus, right? And some compressive forces might cause compression fracture that or also known as impacted fractures. And this last type, which are the compression fractures, are characteristics of spongy one actually, and such as compressive fractures of some vertebra, right? So we also have some fractures that are related to joint involvement. So those would be intra or extra articular fractures. So what are the most serious ones? Well, they are, of course, those that are related to articular, the joint, right? They are intra-articular. Those are the most serious ones because they would also be related to the damage of some other structures rather than just bones, right? There are also cartilage, ligaments, and some other structures, and they also are more serious because they are um, they tend to take longer to heal, and they are involved with decreased range of movement in case of an extremity fracture, right? And here we have fractures according to soft tissue involved. And here we have closed or open, also known as exposed fractures. So fracture, here we have some other classifications. There are fractures that are specifically descriptive classification. Some eponyms here. Here we have the garden, which is based on guide management and the surgical plan. Notice that some classifications are not related directly to bones, but to some other aspects. Here we have the garden classification is related to the management and surgical plan. The near classification assists in describing the fracture for communication. The Schatzker classification predicts associated injuries and prognosis. The Losch-Hansen classification provides sight into the mechanism that we already talked about a little, and the Sanders classification is an example of CT-based classification. We also talked about this. Can anybody tell me what CT means? Hello, guys. We already talked about it. When we were talking about anatomical planes, we said that when we used a transverse plane, it was useful for us for some imaging study, right? Which was a CT. Can anybody tell me what a CT is? Okay, guys, it is computed tomography. In Spanish, tomografía, right? Computed tomography. So this Sanders classification is based on tomography. Okay. Here we have some other classification. Here we have the fragmented displays and some other fractures. Here we have the evolution of any kind of fracture, which is the fracture consolidation. So the bone is a tissue with a high repairing potential. After a period of 4 to 8 months, the fractured bone can be reconstituted without leaving any kind of scar, okay? Always taking into account some essential factors that are always present, okay? Such as a good vessel vascularization of the fragments that are involved, and the stability of a fracture. So that's why we have to avoid the movement between the fragments. Consolidation could be primary or secondary. The second one is the most commonly observed, and it is going to be described right after. There are actually, based on the literature that you might be reading, there are basically 3 stages of fracture consolidation. So, as I was telling, as I was telling you, there are or 3 or 4 stages of fracture consolidation. Here we have the first one on your left is the hematoma formation. So this is the earliest of all the 4 of all 4 stages, and it occurs at the moment of the injury. Those small vessels that are supposed to give blood to the fractured bone are broken, and of course they bleed, right? Uh, and they started making a hematoma uh, around the fracture fragments, and this hematoma turns into a clot, right? Do you know what a clot is? Anybody? Does anybody know what clot means? Coágulo, okay? So it turns into a clot, and that works as the main stimulation to start the process of consolidation. So when there is a clot, that is the main step to start the consolidation process. And it is invaded by small vessels, which is a process also known as angiogenesis, and they bring some cells that are that come from the mesenchymal layer, right? And they can turn into periosteum and uh, some other tissues that might be needed to start the process of consolidation. Right after that, we have the callus formation. Okay, among the first 2 weeks, it starts forming from the fragments. The callus starts forming from the fragments that are involved in the fracture, and it gives like a shape of the bulbin, in which the fracture point is starting to be created. This callus is in the first place, in the first moment, it's like cartilage. Then it starts like a bone nucleus. So that's how it starts ossification, this process. And right after that, we have the bony callus formation and the bone remodeling. And this would be the formation of the tough callus. Okay, and after those weeks that I already mentioned, these mesenchymal cells start to create osteoblasts, right? You know what they do. They start producing tissue, bone tissue at a high speed, and this tissue is formed in a place a little distant from the fractures, uh, starting to show up in an X-ray as you know. Have you ever seen a periosteal reaction in an X-ray? You do know what a periosteal reaction is, right? When the periosteum, it's like you can see it in an X-ray. It's a little thicker than the usual periosteum. So that is the periosteal reaction, okay? When it gets a little thicker, and it can be seen in an X-ray. So after a lapse of around 6 to 8 weeks, it starts this process, and it is completed between 4 to 8 months. And it is faster in children, and it is not longer seen in an X-ray. This would be radiological consolidation. Okay, so the first three steps of this process can be seen in an X-ray. However, the last one cannot be seen in an X-ray. That is the radiological consolidation. Okay, when it cannot be already seen. And after the next 2 months, this callus is like remodeling and reabsorbs the excess of tissue until all the bone and the fragments are and the whole bone is well, goes back to its first state, as if there was never, well, there had never been a fracture. So here we have a clinical presentation of fractures. Of course, the patient comes with history of trauma, pain, and functional impotence, okay, as you already know. So here we have some signs that might be useful for you to recognize fracture. And here we have, well, the patient almost always reaches your medical assist with a history of trauma, pain, and functional impotence. And when we reach the physical examination, the pain is increased when we get to touch the fracture. However, it is increased by 2 factors. The angulation of the fragments that are inside a fracture, and the angulation on the bone, right? It is also noted that this swelling, that sometimes we have ecchymosis, right? What we also known as bruises. Here we have some bruisings, right? And this can also be found when we touch a fractured bone. We can feel some of the fragments moving inside. Some of you might have already noticed this. And even we can, when there are a lot of fragments inside a fracture, we can also hear them, not only feel them. That is what crepitus is, right? You already know this. And of course, we have some other signs that are more easily to recognize, such as deviated fractures. And we see a limb that is, that has a fracture. The deformity could be quite notorious, right? And in the case of a rotational fracture, uh, at the physical examination, it is better if we do not, we try to keep it steady, right? Not move those fragments. However, it could be also noticed by a simple sight. And these deformities can orient us to some specific type of fracture. For example, deformity in a fork shape, right? Does anybody know what fork shape deformity is? Does anybody know what fork is? Fork?
Tenedor.
Right. Do you know what? Here in a fractured wrist, we have wrist like that takes the shape of a fork, and this is a Colles fracture. I mean, there are some findings that would indicate a certain kind of fracture. Does anybody know what Colles fracture is? Colles, Colles fracture. For an extra point, guys, does anybody know what Colles fracture is?
It's a fracture of the distal radius.
Okay, distal radius. Sure. Okay, great. What's your name? I don't have your names on screen right now.
Danitza Zambrana.
Okay, Danita. Yes, you're right. It is related to the radius, to the distal radius, right? So as you can see, and when we have the physical examination, we have a lot of signs that might be related to fractures such as bruising, swelling, deformity, and crepitus. When we talk about deformity, we already talked about, for example, the fork shape wrist related to the Colles fracture, and crepitus when we have fragments inside a fracture. In Spanish, what would you call this kind of fracture? This one? In conminuta, right? So we always have to take into account two main things, okay? We have to, for example, let's say that this patient that got to the emergency department, the OR, right, is supposedly, well, had an accident and might be having a fracture in the lower limb. So what we have to always check is a peripheral pulse, because the fractures and the fragments of the fragments of a fracture could also damage the blood vessels that are supposed to deliver oxygen to peripheral tissues. So they tend to damage vessels. That is why we always have to check peripheral pulse, okay? And always have to check on distal cyanosis, okay? And that is shown on your right. Distal cyanosis might be telling you about some blood vessels damage that could be related to the fracture that you are supposed to treat. And treatment, well, first of all, we have to treat pain, of course, because it is what the patient is mostly coming for, right? Because he might not even know if he has a fracture unless there's a deformity, as we already saw. However, sometimes the patient the only thing that this patient might have is pain. So this is what we should treat first, okay? Pain management. Right after that, with a cast, you know what a cast is. And right after the accident, if there's a trauma history, right, as we already talked about, we have to immobilize the limb or the structure that we might be thinking is fractured, or actually the limb, right? If there is vascular or it is exposed or has fragmented or is a fragmented fracture, this patient needs surgery. How do we know this patient has vascular damage? Well, as I already told you with this one, right? Peripheral pulse and distal cyanosis. And right after that, when we fixed this fractured bone, we have to take our patient to rehab. That is how we usually call it, right? Rehabilitation, to make the patient go back as close as normal previous to the accident. This is what we were talking about. This is rehab, right? Make this patient go as close as normal, if possible, back to normality. So thank you guys. This is the first one. I don't know if you want to, we can go on to the next presentation, which would be about childhood. I don't know if you are willing to it, because it's already almost almost time. So if you want me to, we can go on with the next topic, or we can do it tomorrow, and right after that we can have a practice class. You can decide.
For me, it's fine. I don't know the other ones to continue.
Okay, we have one vote for continuing. So us.
Yes, it's fine.
Okay. So let's go on with our next presentation. So this would be, sorry, how about childhood? I chose this one, growth and development, right? Because those who have already read and had the subject pediatrics, the first thing you have to know is to recognize a healthy child, right? So how do we do that? With this basics, growth and development. Can anybody tell me the verb related to this word, growth, the verb?
Is to grow?
To grow. Okay, to grow, G-R-O-W, to grow, crecer, right? So that would be, since we are talking about growth, would be crecimiento, right? And development, which would mean desarrollo. Okay, so here we have growth and development. So we have to differentiate both terms. What does growth mean? Uh, Growth actually is an increase in physical size, any kind of physical size, okay? And development is a qualitative increase in capability or function. So they are different concepts, but they always go together, right? A person can grow in size, in any kind of size, and might not be having a good development. Like some people that might have some mental illness, right? When they are born. For example, in Spanish, parálisis cerebral infantil, right? PCI. So they keep growing just as usual as any other person. So they grow in size. However, they do not develop in a correct manner. And this both concepts always, as I told you, they are different, but always go together, okay? And they are unique to each individual. This is developmental processes are cephalocaudal and proximal distal. So what does that mean? From upwards to downwards, right? From the head to the lower part of the body, and from proximal to distal. We already talked about it in our first or second class, I think. So here we have age classification. So here we have infant. An infant is from 0 to 12 months of age. A toddler goes from 1 to 3 years. Preschooler from 3 to 6 years. School age from 6 to 12 years. Adolescent from 12 to 18 years. And what about, here we have, when we're talking about infants, we also have some other terms like newborn. Can anybody tell me what a newborn is according to the age?
It would be like recién nacido.
Yes, and how old would this baby would be? I mean,
0
until,
to 3 months.
nope. Anybody else?
What?
A newborn is actually from 0 days
29.
to 28. Okay,
Oh, yes.
from 0, from his or her first day of life to the 28th day of life, that is a newborn. Okay, so it would actually reaching the first month of life, right? However, and this is something that we always have this problem, because sometimes we have this patient that is, for example, this has some kind of disease, and the neonatologist is treating this patient, and this patient turns 29 days, and this specialist does not want to treat any longer, because well, this specialist, actually subspecialist, right, says that this patient already belongs to pediatrics and not to neonatology. So from 0 to 28 days, this little person is actually a newborn. Right after that, uh, does anybody know what might be called? Danitza, I think you were you were doing great. You said 29 days. You missed one day. I know that you already know this. In Spanish, to make it easier.
Can you repeat the question, please?
Okay. Right after a newborn, what stage is followed?
Lactante.
Great. And you divide this this stage in two smaller
Lactante.
stages, right? Yes. You were saying?
Lactante menor y mayor.
Great. Until the 2 years of age, right? Until this little person turns 2 is what your classmates said. So yes, right after that, we have the preschooler, which also represents the toddler. Okay, here in, at least here in Bolivia, that's how we use these terms. Newborn, and right after that, what your partner said, and right after that, preschooler from 3 to 6 years, and all the names that are written on the slide. So we have the growth of an infant and infant measurement. Here we have the head circumference measured at the top of the eyebrow. You know what the eyebrow is, to the widest part of the occiput, right? So how do we measure this? Taking into account the whole circumference of the head, but taking into account these structures, the eyebrow and the widest part of the occiput. Does anybody know what this circumference is? Come on, guys. In Spanish, maybe. Perímetro cefálico, right? And it represents the development of the brain, okay? You also know that children have a higher proportion of head when we compare to the head to the rest of the body. That's why some, well, the most usual trauma these patients have is related to the head, okay? The next one would be chest circumference. It is measured at the, well, taking into account the nipples, right? We already know what nipples are. The next one would be the abdominal circumference, which is related to, well, it is measured at the umbilicus. Can anybody tell me what we call it usually? Well, how do we call the umbilicus usually, not in a medical term? We also talked about it. Does anybody remember? Navel, right? Navel. Navel. Okay, so, and we have this, the length is measured between the highest part of the head and plant of the feet. And here we have some other development measurements, which would be the body weight that doubles by the 5th month. So when a newborn is on his or her first day of life, would be the double by the 5th month, okay, the weight. And also the weight triples by the end of the year. So the weight of of the baby that would have been born at 1 day and is 0 days of life, at the end of the year would have tripled that weight. Okay, the next one would be that the height increases by a foot in the first year. So a foot is like 30 centimeters, right? And it is affected by feeding and nutrition. Uh, Mostly feeding is affects the weight, and the height is affected by intrauteral development, right? As we were saying, these are some measurements and that are related to development in infants from 0 to the second month. This infant gains from 140 to 500 grams, and that is related to growth. And when we're talking about development, it has inborn reflexes, fist, rooting, startle. Those are like the newborn reflexes, right? Can anybody tell me some reflexes that the newborn has? Even in Spanish, if you want to.
Reflejo de succión puede ser.
Okay, great. Suction reflex. Okay, any other?
El del abrazo, no me acuerdo cuál era el nombre.
Reflejo de moro.
Okay, great. That is when we like you're supposedly make the baby fall, right? Like a few centimeters and raises his or her arms, right? On both sides. Okay, Moro's reflex. Any other?
Reflejo de marcha automática.
Great. Okay, walking reflex. Okay, there are a lot of reflexes, right? And the newborn, actually, there are some reflexes that might be considered pathological in adults that might appear when there is a stroke. Okay, so they are, let's say, normal when they are newborns. However, they turn pathological when they are grown-ups. Okay. From 2 to 4 months, they gain from 140 and 500 grams. And when it comes to development, they roll over. Do you know what rollover is? This is a phrasal verb, actually. Can anybody tell me the meaning of rollover? Okay, when a baby, for example, is lying on his or her back and suddenly makes some movements and is, well, with the tummy down. Okay, so in Spanish would be rotarse sobre su propio eje. Okay, to roll over. Okay, and when we're talking about growth, gains from 1.5 centimeters per month. And when we are referring to development, turns his or her head and follows objects and sounds, pushes up on forearms when prone, like you know what prone position is. And from 4 to 6 months, when we're talking about growth, doubles birth weight. At 5 or 6 months, what we already saw, at the 5th month has to double the weight at the born point, and the teeth begin to grow, to erupt. The first one are. Does anybody know what the first teeth to erupt are? incisor. You remember what we already talked about? The names of each, we already talked about the names of each kind of teeth. The first one would be the incisor teeth, okay, between 4 to 6 months. And when we're talking about development, this baby grabs objects at will. Does anybody know what at will is, even in Spanish? Or even better, could you explain it in English? At will? At will in Spanish would be a propia voluntad. Okay, so thinks, and this baby is already thinking and decides to make a movement. In this case, to grab an object. Okay, and manipulates objects, and the head is held steady when sitting. So right before this, the 4th month, you have this baby seated, and by the weight of his or her head would like fall, right, because of the weight of his or her head. However, when this baby reaches the 4th to 6th month, that does not happen anymore, can keep his or her head steady, okay, and supports most of the weight when standing, and vocalizes and laughs. This is the what you already read about, the social laugh, right? Well, it starts at 4 to 6 months. When we're talking about from 6 to 8 months, and we were talking about growth, and the growth rate is slower than the first 6 months. So they do not, well, they tend to grow slower than in the first 6 months of life, and gains from 3 to 5 ounces per week, which would represent 1 centimeter per week, okay? And when we're talking about development, most newborn reflexes are already extinguished. This baby already sits alone, babbling, and I mean, it would be bubbles, right? And uses a speech-like rhythm and responds to sounds and his or her name. So already starts to recognize his or her name. Right before that, his does not. From 8 to 10 months, when we're talking about growth, it is the same weight and height that increases. And when we're talking about development, it reaches the pincer grasps and creeps and crawls. Does anybody know what crawl is? C-R-A-W-L, crawl. Anybody, guys? Does anybody know what crawl is? Okay, it would be gatear, right? Crawl. And pull out to stand approximately by 10 months. Already bubbles, so when we were talking from 6 to 8 months, and says one word, which would be those that are between quotes, and understands the word no. Okay, so starts to recognize some orders, simple orders, of course. And from 10 to 12 months, has the same weight and height that increases at the same range, and the head circumferences equals the chest circumferences. So as I already told you, the head circumference is the higher one of all the circumferences. However, when this baby reaches almost 1 year, this person has an equal head and chest circumferences, and triples the birth weight by 1 year. That I already told you, right? When this baby is born and has certain weight, by the end of the year, the first year, triples the weight at the birth. And when we're talking about development, stands alone and walks along furniture. That means that has to find some support when walking. Okay, and sits from standing. Like this baby is standing and can sit all by himself or by herself. Places objects into holes and learns 1 to 2 words, and receptive speech is more developed. So there are some growth rate that slows at the age of 2, quadrupled the birth weight and half of adult height. By 33 months, all teeth erupted and has already some toilet training. So when we reach this step, this phase, which would be the toddler, gains an average of 1.4 to 2.3 kilograms per year and grows from 5 to 6.5 centimeters per year. As you can see, the development is much more complex. This person can undress his or herself, can throw a ball, dresses him or herself, scribble, runs, jumps, can kick a ball. Like there are more complex movements, right? They can imitate some plays and likes to be around some other children. This is when actually children are reaching the magical age, which is actually when this person is reaching the age of 4. Okay, that is the 4 is like pediatricians call the magical age, because they always tend to link some facts to magical stuff. Okay, and they have receptive speech that exceeds expressive and temper tantrums. And as a preschooler, the growth diminishes from what we saw before to 1.5 to 2.5 kilograms per year, and grows from 4 to 6 centimeters per year. As when it comes to development, it is associative, interactive play, dramatic play, pre-operational thought. Vocabulary has grown a lot. It goes beyond 2,000 words. Can complete sentences of several words, dresses and feeds him or herself, uses utensils, and draws six-part person. This kind of things might seem a little useless. However, when we have a patient, we have to ask the father, the parent, any parent that is going to consultation with the kid. We have to ask him or her, because this could tell us how well the development is going. Of course, the growth is much more to our training, because we have to know how to measure a kid's peripheral circumference or the length of this child. However, the development has always been told to us by any parent. Okay, so this gives us some hints to know how the development is going. And when this person reaches school age, gains less height and weight than they were doing before. You can see it on your left, and girls may begin growth from spurt from 9 to 10 years. And development, when we're talking about development, there's cooperative play and can read, concentrate for longer periods of time, mature use of language, sense of industry, ride a two-wheel bike. So has a lot of more skilled kid, right? And when they reach adolescence, when we're talking about growth, and there is variation in age of growth spurt. Girls gain from 7 to 25 kilograms and grow from 2.5 to 20 centimeters, and boys gain from 7 to 29 kilograms and grow from 11 to 30 centimeters. As for development, they have formal operational thought, abstract reasoning, experiment with risky behaviors, establish identity and values, and focus on peer group and sexual maturity. Here you have some charts that you already read about that could lead us what that could tell us how the growth, especially they're actually based on telling us the growth, how the growth is going. So if you have percentiles, right? So when you have your patient going through examination in certain periods of time, you have this curved line is actually what the length on this left chart, the length for age percentiles in girls until the 36th month. You have this kind of charts related to height and weight, okay? And you construct this line, this curved line, and you can tell how the growth is going. The same here on the right, which is actually for boys, and the left one is for girls. And here we have some nutrition facts in infants. When this person reaches 1 month, it actually has a breast or formula pattern of feeding, right? When from 2 to 4 months, still breast or formula based feeding. Actually, it would have to be until well longer than that, from 4 to 6 months. They begin solids, rice and cereal first, and baby foods, and breast or formula for or more times per day. So actually what the World Health Organization tells us to follow is that this baby should be breastfeeded until the age of 6 months, right? And it also should be prolonged. And from 8 to 10 months, they usually have baby food and soft finger food 3 times a day. That's what TID means, okay? And they have breast or formula for or more times per day, and can use a cup with a lid of 6 ounces per feeding. And from 10 to 12 months, table foods with family 3 times a day, and a cup of lid with a spoon, because has already developed this feature. And with also breast or formula feeded for 4 times per day. There's also physical assessment. Does anybody know what assessment is? It would also mean the same as examination, okay, analysis. Okay, so that would be physical assessment analysis, okay? In infants, we also, in any kind of patient, the first thing we have to do is take the vital signs, or just vitals, as I told you. The infant heart rate is, higher than an adult's, and the respiratory rates may be irregular. However, what is most commonly known is that, well, of course, they have higher heart rate and respiratory rate. They count, well, what we have to do is to count respiratory rate for 1 minute, not just 15 minutes, 15 seconds, and multiply it by 4, right? However, that is what's usually done. However, it's not correct. And the heart rate is taken by apical pulse for 1 minute. And when we're talking about blood pressure, here we have some main differences between this vital sign and ones that we know in an adult, right? And actually, here's a little difference between what in the US is taken into account, and rather than what we actually do. We actually use also percentiles and have these charts, right? Like the ones that I showed you. So according to the age, the blood pressure increases in a normal range. So we also have this another curve that is considered to be normal. And well, when you have your physical examination or physical assessment when taking the blood pressure, you may also construct or might be drawing a new curve. And the other physical assessment are similar to an adult, except in infants. And developmentally, they're appropriate and to approach. We are already finishing this physical assessment. And when we're talking about the occipital frontal circumference, from birth to, we have to take into account this from the birth to the 3rd year, because that is when the brain increases its volume mainly, and to measure the brain that is to measure the brain development and the neurological abnormalities and malnutrition. Circumference should be correlated with the child's length. When we are talking about the ear location, there's a line from the outer edges of the eye that passes through the upper portion of the pinna. So that is how the outer, we also talked about it, right? When there's a line in between the upper part of the ear and the external or outer angle of the eye. So here we have this line that is from these two structures. And we can also have this abnormal angled ear that and this on your right, you have a low seated ear, which could be also related to some chromosome diseases, chromosomal diseases. And based on the development level, how mobile is the child, how cognitive level, height and coordination, nutrition requirements, and what hazard or injuries are typical at this age, development level, and what screens are recommended. Some primary preventions to keep healthy people from developing a disease or experiencing an injury in the first place, and secondary prevention to our interventions to halt or slow the progress of a disease if possible, and limit the long-term disability or prevent re-injury. Tertiary prevention help chronically ill people to manage complicated long-term health problems and maximizes the quality of life. This is not only related to pediatrics, but also to any kind of diseases and prevention. Primary, secondary, and tertiary preventions. This is actually one of the most useful slides that you might have in this presentation. And here we have health promotion and safety by the age group. Here we have an infant and bonding with caregivers, rolling over, putting things in their mouth, beginning to walk, nutrition, bottles, and new teeth. What topics or hazards should the nurse discuss with the family? What injury prevention strategies? So that would be it, guys. It's kind of late. It's 9:30. So I'll see you tomorrow, please. Before you leave, please, we'll have in the polls, okay? So when you're done, let me know.
I finished.
Okay, thank you. Okay, that would be everybody. So I'm going to finish. Okay. Okay, guys, so I'll see you tomorrow with our practice class. Have a good night's sleep and, well, take care. See you tomorrow.
Bye. Good night.
Bye. Good night.